The South African Medical Research Council is calling on the alcohol industry to do more in addressing alcohol abuse. Latest research findings by the medical body reveal that 6 out of 10 people in South Africa engage in heavy drinking every month. Professor Charles Parry is the director of the Alcohol, Tobacco and Other Drug Research Unit, and he joins us now for more insights. Thank you very much, Prof, for your time this afternoon. Perhaps help us make sense of the research and, in a nutshell, the most salient points.
Yes, I mean, if we look at the burden of alcohol to South Africa, it's the 5th largest risk factor for death and disability, and we actually rank 6th highest in the world in terms of the amount of the absolute alcohol drunk per drinker per day, at about 64.5 grams of alcohol, which is about five drinks per drinker per day. And obviously many drinkers aren't drinking that much, so many other drinkers are drinking substantially more. And I think you could say there's a dependence not only among certain drinkers, but also on the alcohol industry on this heavy drinking. In fact, one of my colleagues did some research and found that if everybody drank at moderate or intermediate levels, we would only be consuming about 32% of the alcohol that we do in the country.
Does the research take a look at why people drink?
Well, I think there are many factors. Obviously, we know there are lots of social pressures, but the price of alcohol is very cheap in this country. There's quite aggressive marketing and very little controls on marketing in the country. And if we look at the availability of alcohol, much of the alcohol is sold through unregulated outlets, often 24 hours a day. So it's cheap, it's readily available, and it's highly marketed.
Are children being exposed to drinking at an early age?
I think one can certainly say that. If we look at data from various school surveys, they haven't been done very recently, but we found that young people are drinking substantial amounts of alcohol. I think, if I remember correctly, about a third of the young people in high school were drinking. And in certain places, young people obviously are exposed because of the nature in which alcohol is sold, often from very informal outlets, and they see it in various settings. We even have a situation where the Bella Bill is looking at whether alcohol should be sold at schools, at certain functions. So it's readily available in our society, so certainly exposed to their marketing and so forth.
You mentioned the word burden in the beginning of the conversation, and so in trying to assess the damage that is being done, for lack of a better expression, what then is the consequence of this heavy drinking in South Africa?
Well, as I've said, it not only causes death, but also other harms, injuries. It's certainly been shown to be causally linked to gender-based violence. Affects productivity, young people are used in school, it affects school performance, affects so many areas of people's lives. If we look at individual lives, that can affect non-communicable diseases such as cancers, liver disease, infectious diseases, particularly linked to tuberculosis and to HIV to some extent, and mental health issues. So it affects the individual, but also affects others. As I talked briefly about gender-based violence, and we have, road traffic collisions where sometimes alcohol plays a role, and economic costs. The South African Breweries, or the beer industry, has recently had a meeting on the beer economy, and I think what they failed to look at was the economic cost to society, which are quite likely to be substantially greater than the economic benefit that the country derives. So it really affects us in so many ways.
What is the call to action?
Well, I think there are many things the government should do, but I think one of the things I was wanting to talk about was the role of the industry. And they put a lot of emphasis on education, but I think when you're talking about what the industry can do, they should stop manufacturing so much alcohol. If we look, for example, at South African breweries, and I've done some of the calculations, if we look at how much their production capacity is enough to provide 4 330 milliliter cans of beer for every one of their beer drinkers, which is per day. That's a substantial amount. So we need to cut down the amount that's being produced. The same for the parts of the wine industry. There's often a glut of very cheap wine, which is then sold very cheaply. So reduce the manufacturing. Maybe they can start moving into other sectors. The other is to stop selling alcohol in such large containers, such as these beer in 1 liter and 1.5 liter bottles. We've done our own research at the MRC to show that when people drink out of larger containers, they drink more. So I think we need to look at that. We need to look at marketing. There's very little controls on marketing of alcohol in South Africa. Marketing is really self-regulated by the alcohol industry, and I think we can't leave it to the industry to correct themselves. We need greater controls on marketing. We shouldn't have marketing of beer linked to lifestyle, like economic, financial success. It really should be limited to the actual properties of the product being sold, where it's manufactured, how much it costs, how much alcohol is in it, and so forth. And I think also we need the industry to play a role in putting the number of standard drinks on each container so people know, for example, if they're drinking a quart of beer, it's not just one standard drink. It's about 2.3 standard drinks. Also, the calories need to be on the containers. And I think perhaps most importantly, we need the industry to refrain from pushing back on government's attempt to implement strategies that are likely to reduce harm from drinking. Evidence-based strategies in the area, such as price increases, tougher controls on advertising, and restrictions on alcohol availability. We often see the industry interfering in the policy processes in those areas. And we look at what happened during COVID when there was temporary liquor sales bans, and the industry pushed back heavily on what the government was trying to do to free up capacity in hospitals, and really did result in substantial saving of lives and trauma. And the industry pushed back in so many ways, including many lawsuits, which cost all of us as taxpayers a lot of money, and they were successful in exactly none of them.
Thank you very much, Prof, for your time this afternoon. Professor Charles Parry is the director of the Alcohol, Tobacco and Other Drug Research Unit. When we